first, the story that the dominant backdrop to all of this. Cases, hospitalizations, and deaths are on the rise in the U.S. as the country continues to suffer from the coronavirus pandemic. It's getting much, much worse. Yesterday, the U.S. added over 159,000 coronavirus cases, bringing the overall total to 11.4 million cases. Hospitals continue to run out of space and equipment as more than 73,000 people were hospitalized as of Monday, an increase of over 3,000 from the day before. The average U.S. deaths per day has also now reached over 1,100, up from just under 830 2 weeks ago. The average pace is expected to climb in the coming days. It is getting so much worse, Willie.
It is, and the White House knows it. NBC News has obtained a copy of the White House Coronavirus Task Force latest weekly report to states that delivers an assessment of the pandemic's trajectory. The report, dated November 15th, is jarring. It reads in part, there is now aggressive, unrelenting, expanding broad community spread across the country, reaching most counties without evidence of improvement, but rather further deterioration. Current mitigation efforts are inadequate and must be increased to flatten the curve to sustain the health system for both COVID and non-COVID emergencies. Heading into Thanksgiving, the report warns the upcoming holidays can amplify transmission considerably. States should continue to expand public health messaging across all media platforms, including SMS auto texting, to warn citizens about the risks of social gatherings, advise people to avoid them, and re-emphasize face coverings and social distancing. Specifically, recommend holding an event only with individuals within one's household and emphasize the risk of exposing an elderly person or someone with an underlying condition if gathering indoors without masks. Again, that's the White House Coronavirus Task Force weekly report. Let's bring in President of the American Medical Association, Dr. Susan Bailey, and Chief Nursing Officer for the American Nurses Association, Debbie Hatmaker. Dr. Bailey, let me begin with you. The White House assessment there is pretty stark. It tells the story. What's your assessment of where we are right now?
Things are indeed very grim. Doctors are concerned that our hospitals are filling up and that we really need to double down on our basic preventive measures, wearing masks, washing hands, keeping 6 feet apart, and avoiding large indoor gatherings. We have some vaccines and exciting things coming around the bend, but we want to be ready for them when they get here. And so we need to work as hard as we possibly can right now to slow down the number of new cases.
Debbie, we've seen nurses doing interviews, trying to get the word out to show what it really looks like in these ICUs, what it looks like in a COVID unit, many of them being overrun across the country. What can you tell us about what your nurses are seeing there on the front lines?
Well, thank you, Willie, and I'm pleased to be here this morning to represent the nation's nurses. We are hearing that things are quite stark, and we're very concerned that this delay in the transition is negatively impacting that. Just this week in North Dakota, we heard that some facilities are running critically low on supplies and that nurses are being asked to transition and work in other units for which there hasn't been time for orientation and for adequate preparation or training for that. So we're concerned about that, and the delay in the transition only impacts that. So it is time for the Trump administration to begin to prepare the Biden transition team on those important issues around the stockpile for the necessary critical medical equipment. We're still seeing delays in PPE, inadequate supplies on PPE, and this will only get worse with the delays in the transition.
So, Dr. Bailey, before I get to my next question, I'm wondering if you could develop upon that point the actual impact of not sharing the information. Will it cost lives?
We are very concerned about that. And an example when shift change occurs in a hospital, doctors, nurses, everyone in the hospital needs to transfer information about their ill patients as quickly as possible and as completely as possible to make sure that nothing falls through the cracks in taking care of that particular patient. Well, we're in that situation now on a national level, and the American Medical Association, American Nurses Association, and the American Hospital Association are all asking the Trump administration to provide that morning report, that seamless transition, that information that we need to make sure that every patient is taken care of and nothing falls through the cracks.
So, and Dr. Bailey, a follow-up. The folks from the Biden coronavirus task force are saying the first thing the president's going to do, the president-elect Joe Biden, is invoke the Defense Production Act on things like testing and PPE supplies. It seems like right now the state of testing is still quite marginal, difficult, not where it should be. It's either inaccurate or there are delays. You can't get immediate responses. Sometimes you wait 5 days, which, of course, makes treating the coronavirus and stopping the spread much more difficult. Would you agree that almost the most basic thing one can do right now is uniformly across the country wear a mask?
The AMA has recommended that everyone wear a mask for quite some time right now. And yes, there are shortages in supplies of basic testing equipment, of the chemicals that are used. We're doing lots of other tests in hospitals right now, too, as we come on flu season. Reminder, everybody get your flu shot. And that makes it more difficult, even more to get the test done. And so there's lots of different tests out there. There's a lot of confusion about which test to run, where to go to get it, how long you're going to get the results back. And we're starting to see an increase in delays in test results because so many more are being done and supplies are short.
So, Dr. Hatmaker, let's end this segment. The numbers are grim. Infections have gone up. Deaths are moving back up again. But let's give our audience some reason to hope that we are actually moving in a positive direction. I saw yesterday in the New York Times a widespread study, talking about how immunity may actually last for actually years. They don't know yet, but one of the largest studies showed that. The viral load seems to be a little less intense in the fall than it was in the spring. And also, of course, therapeutics. And just the way what you've learned over the past 6, 7, 8 months, you've learned an awful lot about COVID patients when they first come in that you didn't know in early March. What advances have we made?
So, Joe, you have pointed out we have made advances in treatment. We are seeing lower mortalities, but we are still concerned about the case numbers and the strain that it's putting on our healthcare providers and our systems. We're very excited about what is just around the corner with vaccinations, but we've also heard in our surveys of nurses that they need additional information and education in order to be adequately prepared to do the mass vaccinations that are just ahead. And I will say it's going to be important for the transition team, for the new Biden administration to receive the protocols for Operation Warp Speed in order to prepare adequately for equitable distribution of those vaccines. Nurses and other healthcare providers will be key in distributing and administering those vaccinations. So we need our politicians to stop politicizing this pandemic and to step up and be role models and to continue and to move ahead with the transition in order to be prepared for vaccinations and to move us past this critical surge in the pandemic. We're wasting time and we're impacting lives the longer this delay continues.
Well, we want to thank you both, President of the American Medical Association, Dr. Susan Bailey, and Chief Nursing Officer for the American Nurses Association, Debbie Hatmaker. Thank you both very much for being on the show this morning.